How you doing, man? What's going on?
38-year-old Jason Harrison was shot and killed outside his Dallas home last June.
What's going on? You drop that for me? Drop that for me, guy.
Jay!
Drop it!
Jay!
Drop it!
Jay!
He was carrying a screwdriver that officers on the scene said they found life-threatening. His mother says he wasn't violent. She simply needed help transporting her bipolar and schizophrenic son to the hospital to get back on his meds. His death remains murky, but many say one thing about it is clear: that in this country there remains a dangerous, at times lethal, lack of awareness about mental illness.
Mental illnesses are still very much misunderstood. They're still very much the subject of stigma and stereotypical and sometimes prejudicial assumptions.
Ron Honberg is National Director of Policy and Legal Affairs for the National Alliance on Mental Illness. He says it's exactly these misconceptions that can lead to deaths like Harrison.
Officers are oftentimes trained to take control of situations, and control oftentimes means acting fairly aggressively. Speaking loudly, it can mean surrounding an individual, it can mean coming onto a person in a way that seems threatening. Well, for someone who is in a full-blown psychiatric crisis and who may be experiencing delusions, that kind of response may escalate the crisis, and sometimes it can even result in deadly circumstances.
By some estimates, at least half of all people shot and killed by police in the United States have mental health problems. That's 1 out of every 2 fatal encounters. And that's led some 2,700 police departments around the country to establish programs that specially train officers for situations involving mental illness.
Voices, do you think I'm crazy? You think I'm a crazy person?
Our police injuries have almost stopped. Injuries to people with mental illnesses have gone way down. Shootings of people with mental illnesses have gone way down.
Stephen Leifman is a judge for Miami-Dade County's criminal division. He's also a crusader for improving outcomes for the mentally ill caught up in the criminal justice system.
All right.
He says bringing the trainer program called Crisis Intervention Team, or CIT, to his district has been a game changer.
The City of Miami Police, before we had the CIT program, had 1 shooting a month, usually fatal, of a person with mental illness. They've had maybe 4 or 5 in the last 8 years.
And I take a different approach to, try to talk to them, make sure they're okay.
Marco Caceres of the Miami Police Department has been a CIT-trained officer for 4 years, and he hasn't had a single mental health call become physical. He says a little bit of empathy and patience can go a long way.
Most of them respond real well to me actually, trying to reach out to them. And instead of fighting me, they'll actually accept or will want to accept my help.
It's a common assumption that people with serious mental illness tend to be more violent. But Leifman says research shows just the opposite.
In fact, for people that are on medication with mental illnesses, prevalence of violence is much lower than the general population. And frankly, they're much more likely to be victims of violent crimes than perpetrators.
Those who do pose a threat to public safety have behavior linked directly to not receiving treatment. Some 60% of adults with mental illness aren't getting the help they need.
The people that want to help are overwhelmed with work. There's no money for anything.
Justin Volpe is one of the estimated 9.6 million Americans who lives with a serious mental illness. He was diagnosed with schizophrenia when he was 22 and, without consistent care, ended up addicted to drugs and living on the streets.
I must have only weighed 135 pounds soaking wet. I stunk, I was dirty. I was disorganized, I was hearing voices, I was seeing things.
Volpe now works as a peer specialist for the program that he credits with his recovery.
Your goal is to de-escalate.
The brainchild of Judge Leifman, Miami-Dade County's Criminal Mental Health Project does what a fragmented mental health system cannot. It gets people treatment and makes sure they don't fall through the cracks. For the most seriously ill, that involves taking them to doctor appointments, signing them up for benefits, and even finding them housing.
So this is it, huh? People do get better, and that's what people don't understand. I was on the street, I was one of those people, and now people don't even believe it when they see me.